Ever wondered if there's, more to recovery than just rest and ice? Like, could we fundamentally shift how the body heals? That's the kind of question I find really fascinating. And today we're diving into something that, well, I just do that.
Exactly. We're doing a deep dive into hyperbaric oxygen therapy, HBO for short. Think of it as maybe a booster shot for how we recover from injuries, maybe even some illnesses. We've got some interesting research here, looks at how it might work across a really wide range of conditions.
HBO. Okay, so for someone hearing that term for the first time,
Yeah.
what are the nuts and bolts? It sounds pretty technical.
Well, in essence, it means breathing pure oxygen inside a specially designed chamber, one that's pressurized. Imagine sort of a controlled dive underwater. But here, the increased pressure is actually the point. It's therapeutic. Usually, we're talking pressures about 1.5, maybe 2 atmospheres absolute, so 2 ATA. That's like being, roughly 33 feet underwater.
Okay.
It's noticeable, yeah, but safely managed.
All right, so you're essentially just flooding your system with more oxygen. What does
Yep.
that actually do inside the body? What's the effect?
The main effect is what we call hyperoxia, basically a big jump in the oxygen dissolved in your blood plasma. And this lets oxygen get into tissues, into cells that might be struggling, maybe because of poor blood flow from an injury or disease.
Ah, okay.
It's really about getting that vital oxygen to where it's most needed for repair.
Okay, that makes sense. Like more fuel for the healing process. Let's look at some specific areas. Our sources talk quite a bit about neurological rehab, starting with stroke recovery.
Yeah, and what's interesting there is the target. After a stroke, there's often brain tissue around the main damaged area. They call it the penumbra.
The penumbra, right.
It's not dead, but it's not working right either. Dormant, maybe? The idea with HBO is by boosting oxygen delivery, you might help wake up these neurons. Research suggests this could help ease muscle stiffness, spasticity, improve movement, maybe motor strength, and potentially even lower the risk of another stroke. We also see hints it might improve stamina, both physical and mental, for stroke survivors using HBO in rehab.
Wow.
So the key isn't fixing dead tissue necessarily, but maybe reactivating those compromised areas nearby. That's a very different way to think about recovery.
That is a really compelling idea, kind of jump-starting those sluggish brain areas.
Mhm.
And it's not limited to stroke, right? There's potential for other CNS injuries too, like TBIs and spinal cord injuries.
Exactly. For TBI, traumatic brain injury, the reported benefits include reducing cerebral edema, that's dangerous swelling in the brain,
Right, a swelling.
especially early on. It also seems to help with reducing spasticity and just generally speeding up recovery. Some studies even hint at better cognitive function, especially if you combine it with mental exercises, brain jogging they call it, and relief from those awful post-traumatic headaches. Now, there was one older study that cast doubt on HBO for TBI, but it had some issues, methodologically speaking. More recent evidence does seem to support its use, particularly for those lingering post-concussion symptoms some veterans deal with.
And for spinal cord injuries, what's the potential impact there?
For SCI, the focus seems to be on easing spasticity, which can be a huge challenge, and also improving vital capacity.
Lung capacity.
Yeah, how much air you can breathe in and out. Crucial. We're also seeing potential for better exercise tolerance and maybe even reducing hyperammonemia.
Hyperammonemia.
It's a buildup of ammonia, can cause fatigue, especially after activity. So it's really about improving overall function, quality of life for people with these very significant injuries.
And beyond these more acute injuries, it looks like HBO is also being looked at for chronic conditions like MS and muscular dystrophy as a support for physical therapy.
Yes, the thinking there is by getting more oxygen to the muscles, HBO might improve physical performance capacity. So maybe it helps people with these conditions engage more effectively in their PT sessions, even if we don't fully know its long-term effect on the disease itself. It's about maximizing what they can do.
Okay, let's switch gears now. Let's talk about the heart. Our sources mention HBO in cardiovascular rehab, especially after a heart attack, a myocardial infarction. Sounds like there might be some nuances there.
It's interesting, yeah. There's a difference between using it right after a heart attack versus during the recovery phase later on. While there's still some debate about its role in the acute phase, it looks more promising in rehabilitation.
How so?
The main thing seems to be boosting exercise capacity for patients recovering. This lets them do more exercise therapy, which we know is absolutely vital for preventing future heart problems.
Right, getting them moving again.
Exactly. And there's even some indication, though it needs more research, that long-term use might help reverse artery plaque buildup, atherosclerosis. Plus, for people with high blood pressure, combining HBO with exercise therapy shows some potential for lowering BP. So maybe not a first-line treatment right after the attack, but potentially a valuable tool for rebuilding heart health later.
That idea of boosting exercise capacity keeps coming up, and it applies to other circulatory issues too, like peripheral vascular disease, the kind that causes that ischemic leg pain. That sounds really tough.
Oh, it is very debilitating. And here, HBO is used to help people get through exercise therapy by pushing back the pain limits.
So they can exercise for longer.
Yeah, imagine being able to walk longer on a treadmill because your leg muscles are getting more oxygen. The research suggests increased pain-free exercise ability, less pain even at rest.
Hmm.
A reduction in harmful biochemical changes in those oxygen-starved muscles, and it might even counteract the blood vessel narrowing that HBO itself can sometimes cause.
That's interesting.
And what's really encouraging is that these benefits might actually stick around, sometimes even after the HBO treatments stop, once you reach a certain level of improvement.
So again, HBO acting as a kind of enabler, helping other therapies like exercise work better. Okay, now let's dive into something I know a lot of listeners are interested in, sports injuries. It sounds like HBO's been around in this field for a while.
Yeah, seems like it. The sources suggest it's been used for sports injuries for maybe 25 years or so. And the proposed mechanisms are quite interesting. The idea is it might blunt the initial injury response, controlling certain immune cells and damaging free radicals,
Okay.
and then later boost the healing itself. Things like collagen formation, building blocks for tissue and clearing out damaged stuff, phagocytosis.
So like calming the initial chaos and then helping to clean up and rebuild.
Pretty much. Imagine the injury site is just inflamed and noisy. HBO might help quiet that initial noise, let the body's repair signals come through more clearly.
We have a specific study mentioned here on ankle sprains. What did that find?
Ah, yes, the Borromeo study from '97. It found that HBO, at that higher 2 ATA pressure, did significantly reduce the pain athletes reported compared to a control group breathing normal air.
Okay, less pain is good.
Definitely. But interestingly, it didn't actually shorten the overall recovery time or improve their range of motion any faster than the control group.
Huh. So pain relief, yes. Faster return to play. Not necessarily, at least in that study, for that injury.
Exactly. It's a nuanced finding. Challenges that simple idea that HBO just speeds everything up.
And what about other common soft tissue things athletes get? Muscle strains?
Yeah.
Ligament injuries?
Well, there's a big review, a Cochrane review in 2010. They looked at studies on things like muscle soreness, DOMS, acute knee ligament injuries. Their conclusion was basically not enough strong evidence yet. A lot of the studies were small.
Right. Small sample sizes are always a problem.
Yeah. They did see some suggestion of improved ankle function in one study, but the measurement scale they used wasn't fully validated, so grain of salt. The main point was we really need more robust research for these kinds of injuries.
Okay, but it sounds like maybe combining HBO with other advanced therapies could be promising, like with PRP, platelet-rich plasma, for hamstring injuries.
Now, that is a really interesting finding. That 2015 analysis looked at rugby players with hamstring tears. Those who got a combo of HBO, PRP, and physical therapy had significantly shorter recovery times compared to guys who just got traditional rehab.
Significantly shorter.
Yeah, and importantly, fewer re-injuries, too. For grade 1 and 2 tiers, it suggests maybe HBO creates a better environment for other regenerative treatments like PRP to work more effectively. It's not just one thing, but how they work together. Synergy.
Interesting. Beyond specific injuries, what about general benefits for athletes? There was a summary table mentioned.
Yes, that table listed several potential pluses for sports injuries overall, reducing swelling and pain early on, speeding up recovery and return to training, possibly helping fractures heal faster, and even helping athletes recover from severe exhaustion or collapse.
So it paints a picture of HBO as a helpful tool in the recovery toolkit.
Exactly, a supportive tool to potentially get athletes back faster.
Now, this is a really crucial point, isn't it? We've been talking recovery.
Hmm.
What about using HBO to actually boost athletic performance in healthy athletes? That sounds like it could be controversial.
And it is. The evidence we have seems pretty clear on this. No solid proof that HBO enhances physical performance limits in normal, healthy people.
So not a performance enhancer like, say, steroids or something.
Right. Not in that sense. However, There is some anecdotal stuff, like from the Nagano Winter Olympics, suggesting it helped athletes recover faster from fatigue, bounce back between efforts.
Ah, so recovery between events maybe, but not making them inherently faster or stronger.
That seems to be the idea, more about restoration after intense effort, not pushing peak ability higher.
Yeah.
And we also have to think about potential risks, like oxygen toxicity if you exercise really hard under pressure, and the fact that some sports bodies might restrict oxygen use anyway.
What about just everyday muscle soreness after a hard workout? DOMS. Does HBO help with that?
Ugh. Delayed onset muscle soreness. There was a study back in '98 looking specifically at that. They found HBO, whether used right after exercise to prevent it or later to treat it, didn't really make a significant difference, not based on blood markers or MRI scans anyway.
So probably not the cure for post-leg day agony then.
Doesn't look like it, no.
Okay, interestingly, the sources also mention HBO in a totally different area, helping amputees with their rehab.
Yes, that 2013 study showed some really promising results there. They found HBO therapy seemed to speed up the process of adapting to a prosthetic limb for lower limb amputees.
How did it help?
Well, it led to shorter hospital stays, improvements in various physical things like better tissue oxygen levels, stronger pulses, fewer wound complications,
Well,
increased muscle size in the sound leg, a stronger residual limb, and just overall better functional ability. That's a really positive finding for people facing a very challenging recovery journey.
absolutely. That's great news for that population. So looking ahead then, what's the future hold for HBO in rehab and sports medicine? Sounds like it's gaining traction.
Well, the fact that more pro sports teams are using it certainly suggests a growing belief, at least anecdotally, in its value for injury recovery. There's even this vision, maybe down the road, of integrated rehab centers with pressurized PT rooms. Imagine doing your exercises while breathing 100% oxygen.
Huh. That's technically possible.
Technically feasible, yeah.
Yeah.
Could potentially amplify the benefits, but as we've said, we still need more solid, rigorous research to really nail down its role, especially in sports, and understand exactly how it works best for different conditions.
Okay, so let's try and wrap this up. For you, the listener, it seems like HBO therapy is a really interesting possibility, but mostly as a supportive treatment, an add-on. We've seen potential benefits in neurological recovery, stroke, TBI, and cardiovascular health by making exercise easier and maybe speeding up healing for certain sports injuries, especially when combined with other things like PRP.
That sums it up well. It's crucial to remember, though, it's not a magic bullet, not a standalone cure, and it doesn't seem to boost performance in healthy athletes. Also, while anecdotes and some smaller studies are encouraging, particularly in sports, we just need more large-scale, high-quality research to be absolutely sure about its effectiveness across the board.
Right. So hopefully you now have a clearer picture, a more informed view of what the science currently suggests about HBO as an adjunct and extra tool in rehabilitation in sports medicine. It really is a fascinating mix of physics, biology, and the body's amazing ability to heal.
Yeah, and maybe this leaves you with a question to think about. If we start integrating technologies like HBO more routinely into recovery plans, what could that future look like? How might we really optimize healing across different fields, from medicine to sports? Definitely something worth considering.